The federal government says it is tackling the dwindling state of primary healthcare centers in the country through the expansion of human resources for health to meet the demands for primary healthcare at the rural level. At a review meeting with stakeholders in the health sector, government says it will also provide access to services including disease prevention, response to outbreaks, and also work with traditional leaders to engage citizens on the need to access primary healthcare services. Aishat Salihu now reports.
It's the fourth quarter review meeting with the Northern Traditional Leaders Committee on PHC delivery, with deliberations aimed at addressing the challenges of routine immunization and disease outbreaks among other health concerns experienced in the region through PHC services.
The polio issue is still there, even though the wild polio is no longer there, but they still have polio cases, especially in the northwest. What really happened? Have we gone to sleep in some places, and some places we have been wide awake walking? We won't lay blame on anybody, but we will talk about where we went silent.
Many of the northern states that are most affected have security challenges. Communities are difficult to reach. People are moving all of the time to keep safe. Health workers are finding it hard to stay in these places. So all of these things are specific targets of our health system revamp that we're going into now, discussing with the gatekeepers of the communities, the traditional leaders, to say how do we remove some of the barriers to usage of the services, to demand by the people, whether it is the ability to access the services, whether it is the willingness to access the services, where there is hesitancy for vaccines, for example, what is driving the hesitancy and what do we need to do about it.
The Health Ministry says collaboration with the traditional leaders will result in the significant reduction of avoidable death and risks of preventable communicable and non-communicable diseases.
And we use that engagement to share with them the direction of government and call on their partnership with community leaders so that they educate their population to use the services, so that if a pregnant woman discovers she's pregnant, she goes for antenatal care. But when she's about to deliver, she goes to deliver. When her child is delivered, she goes for vaccination. And when outbreak responses are being conducted, they participate and accept the vaccines. These vaccines are provided by the federal government and our development partners. They are not free of cost. They are investments that we're making so that we can safeguard the lives of our children.
At the review meeting, Nigerians were enjoined to take advantage of the efficacy of vaccines following the achievement of a record of 4.7 million vaccinated adolescent girls across 14 states in the first phase of the HPV vaccine against cervical cancer. Aisha Salihu, Trust TV News, Abuja.